Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe drug Citalopram. Overview and indications. Citalopram is a selective serotonin 5-HT reuptake inhibitor SSRI. Citalopram is indicated in treatment of major depressions. Dose: adult alcoholic abuse, dose will be 40 mg once daily. In depressions, 20 to 60 mg once daily. Diabetic neuropathy, dose will be 40 mg once daily. Panic disorder, 20 to 30 mg per day. Tension headache, 10 to 40 mg per day. In pediatric doses, efficacy and safety not evaluated. Administration: take in morning in order to avoid nighttime insomnia associated with SSRI. Strength is available in tablet 10 mg and 20 mg. Patient counselings: at least 14 days should elapse between discontinuation of citalopram and initiation of treatment with monoamine oxidase inhibitors or the discontinuation of monoamine oxidase inhibitors and the initiation of the treatment with citalopram. Periodic monitoring of heart rate, blood pressure, hepatic function test, and complete blood counts in advised during prolonged therapy. Pregnancy category C. Use with caution if benefits over risk. Animal studies show risk and human studies not available or neither animal nor human studies done. Lactations, unsafe drug. Contraindications: fluconazole, citalopram and fluconazole both increase QT prolongation, that's why it is contraindicated. Seleglin and citalopram both increase serotonin levels. Phenelzine and citalopram both increase serotonin levels. Miss dose: if you miss a dose, take it as soon as you remember. If it is near the time of next dose, skip the missed dose. Take your next dose as the regular time. Do not double the dose to catch up. Storage: store at room temperature, away from light and moisture. Keep all medicine away from children. Warning: in short-term studies, antidepressants increase the risk of suicidal thinking and behavior in the children, adolescent, and young adult less than 24 years, taking antidepressant for major depressive disorder and other psychiatric illness. This increase was not seen in patients older than 24 years, and slight decrease in suicidal thinking was seen in adults greater than 65 years. In children and young adults, the risk must be weighed against the benefit of taking antidepressant. Patients should be monitored closely for changes in behavior, clinical worsening, emergency of suicidal thoughts and behaviors, and suicidal tendencies. This should be done during initial 1 to 2 months of therapy and dosage adjustment. The patient family should communicate with abrupt changing in behavior to the healthcare providers. Worsening behavior and suicidal tendencies that are not part of presenting symptoms may require discontinuation of therapy. This drug is not FDA approved for use in pediatric patients. Adverse effects: ejaculation disorder, impotence, fatigue, somnolence, dizziness, lightheadedness, fainting, confusion, hallucination, nausea, dry mouth, diarrhea, rhinitis, sweating, tremor, leukopenia infrequent, lymphadenopathy rare, myocardial infarction rare, purpura rare, anemia rare, leukocytosis rare. Precautions. Before taking citalopram, tell your doctor or pharmacist if you are allergic to it or not to citalopram, or if you have any other allergies. This product may contain inactive ingredient which can cause allergic reaction or other problems. Talk to your pharmacist for more detail. Before using this medication, tell your doctor or pharmacist your medical history, especially a person of family history of bipolar, manic, depressive disorder, personal or family history of suicide attempts, liver diseases, seizures, low sodium in the blood, bleeding problem, personal or family history of glaucoma, angel closure type. Citalopram may cause a condition that affect the heart rhythm, QT prolongation. QT prolongation can rarely cause serious, rarely fatal, fast irregular heartbeat and other symptoms such as severe dizziness, fainting that need medical attention right away. The risk of QT prolongation may be increased if you have certain medical conditions or taking other drugs that may cause QT prolongations. Before using citalopram, tell your doctor or pharmacist of all drugs you take and if you have any of following conditions: certain heart problem, heart failure, slow heartbeat, recent heart attack. Do not drive, use machinery or anything that need alertness or clear vision until you can do it safely. During pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. Also, babies born to the mothers who have used this during the last 3 months of pregnancy may rarely develop without symptoms such as feeding, breathing difficulty, seizures, muscle stiffness, or constant crying. This drug passes into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. Thank you for watching Daily Drug Info.